Dementia is an acquired global impairment of intellect, memory, and personality, but without impairment of consciousness. Dementia occurs more commonly in the elderly than in middle age. Etiology: significant loss of neurons and volume in the brain regions devoted to memory and higher mental functioning. Environmental factors like infections, metals, and toxins, excess amount of the metals and such as zinc and copper, deficiency of vitamin B6, B12, and folate. Untreatable and the reversible causes are degenerative disorder of the central nervous system, Alzheimer's disease, Huntington's chorea, Parkinsonism disease. Treatable and the reversible causes are vascular dementias, space occupying lesions, and metabolic disorders like hepatic and renal failure. Infections include meningitis and encephalitis, alcoholic intoxication, heavy metals, anoxia due to the anemia, post anesthesia, chronic respiratory failure, vitamin deficiency, and trauma like subdural hemorrhage. Types of dementia: cortical dementia is a dementia where the brain damage primarily affects the brain's cortex or outer layer. Cortical dementia tend to cause problems with the memory, language, thinking, and social behavior. Subcortical dementia is a dementia that affects the part of the brain below the cortex. Subcortical dementia tend to cause changes in the emotions and the movement, in addition to problems with the memory. Progressive dementia is dementia that gets worsened over time, gradually interfering with the more and more cognitive abilities. Primary dementia is the dementia that does not result from any other disease. Secondary dementia, dementia that occur as a result of physical disease or injury. Stages of dementia: stage 1 is an early stage which has the forgetfulness, a declining interest in environment, hesitancy in the initiating actions, poor performance at work. Stage 2 is a middle stage with symptoms of progressive memory loss, has difficulty in following simple instructions, irritable, anxious, wandering, neglect personal hygiene, and social isolation. Stage 3 is the final stage. Symptoms are marked loss of weight because of the inadequate intake of food, unable to communicate, does not recognize the family, urinary incontinence, fecal incontinence. Death is caused by the aspiration pneumonia. Diagnosis is based on the cognitive assessment. Mini mental status evaluation shows cognitive impairment. Functional dementia scale, MRI for structural and neurological changes, spinal fluid analysis which shows the beta amyloid deposit. Treatment include tacrine hypochlorite, donepezil hypochlorite, NMDA antagonist like memantine, antipsychotic agents like risperidone, quetiapine, olanzapine, antidepressant and mood stabilizer like serotonin, selective serotonin reuptake inhibitors.